mentioned agoraphobia. What is agoraphobia and how is it related with panic disorder? Agoraphobia involves, the fear or avoidance of situations where escape might be difficult or help unavailable during a panic attack. So the patient thinks that if I put myself in this situation, if I need help, I may not get that help. Okay. So they may avoid places like public transportation. They may avoid places like enclosed rooms. They may avoid things like even being outside of the home. Okay. They may avoid standing in a crowd because, hey, in case my panic attack comes up, how am I going to deal with this? And agoraphobia significantly impacts their daily functioning because it is associated with higher levels of disability or unemployment. What do I mean by that? For example, if this patient needs to work as maybe a welder and they have to be under a car, to do the welding. Because of the agoraphobia, you feel enclosed under that bonnet or whatever. They cannot do the work. For example, because of their concern with being in enclosed areas, they may not even be able to work in office enclosures, right? They can't work in a place where you have to work with a team, so this can affect their employability skills. And remember that health is not only the absence of disease, but it is the total well-being of the person, socially, religiously, the lack of a medical condition. So when you're dealing with the health status of people, don't only look at, oh, does the patient have cancer or no cancer? Does the patient have diabetes or no diabetes? Does the patient have hypertension or no hypertension? But look at the patient in totality. Look at the patient in totality. All right. So, what is the suicide risk in panic disorder as well? Because the objective also mentioned it. So, I'm going to touch on it. Individuals with panic disorder have a higher likelihood of attempting suicide compared to the general population. So, that's another exam point there. If you are preparing for your Q1 exam, learn these, things because um, I can easily quiz you on that in your MCQs or in your CDMs or whatever. I can easily quiz you on something like this. Okay. Now, what factors? Now look at this one. What factors predict poorer outcomes for patients with panic disorder? We've already learned some of the psychiatric comorbidities, but what are the factors which can predict that these two people have panic disorder, but this one may do better than this one? If someone has panic disorder with associated major depression, it's a bad, like it spells out that their outcomes are not as good as the general population with just panic disorder. Number two, panic disorder with agoraphobia, the fear of being, in situations where they can't help themselves, like enclosed areas, like public transportation. Panic disorder with personality disorders. That's also a very big one. Panic disorder. So these three psychiatric conditions or mental health conditions, predict a poorer outcome for patients with panic disorder.